So you've been in this Lyme world, obviously, for a long time, over 40 years, and you're doing some amazing work for everyone in the Lyme community and, trying to find a cure for us. Do you think that Lyme is ever going to have a cure? Are we ever going to have a test that tracks our progress and can tell us that we're cured of Lyme? Or is this something that you're always just going to have to manage at some point? And hopefully the dapsone kind of keeps it in check and fixes a lot of things. But are you still going to have to kind of, in the back of your mind, worry that you have this infection living in you?
So you're asking at this point, of course, a very important and unanswerable question. But in the mouse model that Tufts did, rifampin and dapsone cured Lyme. I now have patients for years in remission that the symptoms have never come back. And that's with getting COVID, getting the flu, having all kinds of illnesses. Now, it's possible in some people there is a cure. It's possible in some people, and I believe Bartonella, by the way, Lyme, by the way, is much easier to cure than Bartonella. I will tell people this right away. If you don't have Bartonella and you don't have Babesia, the 9-week dapsone protocol, if you don't have mold and things, you're going to feel pretty good when you're done with this protocol. But that being said, I do think some of these people have been cured because they've gone for years without symptoms, without ever relapsing. So there is hope for the Lyme community. I think many may be cured. But regarding what's not easily cured, it is definitely Bartonella. Bartonella is showing up in 90%, and I have to use multiple pulses of dapsone, these 2-week pulses. But again, after I do that in a certain number of people, they will go into long-term remission. So there is hope for the Lyme community. It's not like I get every person in my practice better, but honestly, over 95% of these people get their lives back. And it's really only the ones that have chronic Bart and mold that I'm just working on, or they have long COVID where we don't have an answer yet, a good answer.